Yeah. Okay, I'm going to make it very quick and simple. We need to save time. We're fairly late. The reason why we're looking at fat in the liver is very simple, and that's because of non-alcoholic steatohepatitis. Today it constitutes about 10% of all newly diagnosed chronic liver disease. It resembles alcoholic-induced liver disease in all respects. That means it progresses to cirrhosis. You can get HCCs. Its whole clinical pattern is very, very similar. And today I think we are seeing, after Hep C, reduced incidence of Hep B because of vaccination, but still some Hep B. And beyond that, we're seeing alcohol-induced cirrhosis dropping, and we're seeing NASH coming in. And one of the reasons why you're seeing a lot of NASH, and NASH is so important because it silently creeps on you and you end up with chronic liver disease. There's a higher incidence in patients who have metabolic syndrome, diabetes, hyperlipidemia, and nearly 20% of the world's population today is estimated to have metabolic syndrome. So how do you pick up a fat? And I won't go into all the different modalities, but it's very clear, believe what I'm saying, that the absolutely most specific and best method is using MR spectroscopy, okay? And because we can measure all the different fat components, CH2, CH3, and add them up and get very, very nice spectra, okay? So I go into it straight and I show you results that what we've done. This is typically MR spectra from the liver, and usually these people have just diffuse changes. We're not talking about ones with focal lesions. And you have the water peak and you have a very small lipid peak. And you can easily estimate the fat content because of the area under the curves, okay? So you take the area which you'd get here, as you get the integral here, of the area under the fat lipid curve divided by the fat and water curves, the area. And that's where you get the percentage. This one was absolutely normal, 0.3%. The cutoff is 5%. You shouldn't have more than 5% fat in your liver. And this is one with 4%. You can see a slight bump up in the lipid peak. And then you have here somebody who has obvious fat, a huge lipid peak, and with a roaring 33% of fat in the liver. And this is somebody who's very prone to going into NASH. Here's another individual where you have a high lipid peak, 49%. Okay? And let me tell you what we did. What we did was we just took people from the department. We started off just with people from the department. And these are absolutely normal appearing guys. You have no suspicion that they're non-obese individuals, and we're seeing a very, very high incidence, and Amol will tell you a little bit of the statistics of what we've got, and just showing you, and this is a X-ray technician. The previous one was a resident doctor with 49%. This is another X-ray technician, 33%. And here's one, this is another doctor in our department with fat content 21%. And here is the individual who had a focal fat infiltration. And when we did the spectra from that, you can see the huge bump up because confirming its focal fat infiltration. Amol is going to present the results of the study that we've done, which is an in-house study. By the way, this is Amol's spectra. And this is a spectra that he had done, okay, on 28th of April. And his lipid content was 26%, okay. He naturally got shocked and he lost weight, cleaned up his act, and he did his spectra a month later and the fat content had dropped to 16%. So it's a very, from this point of view, it's a very, very useful, simple, easy test to do, and it's amazing. We did 80 patients, okay, because all in-house patients, of which I think 60 were males, correct me if I'm wrong, 20 were females. It's amazing that the females had hardly a high fat content. We only, I think, had how many females? 2 females who had a high liver fat, but both were obese.
Yeah.
Both were obese. Whereas out of the males, which was a large group, 60 of them, we had about what, 46?
Yeah.
46 had a high fat content, abnormal. That is above 50% had abnormal fat in the liver, and these are routine guys working every day. Out of the guys who had abnormal fat, high fat in the liver, the non-obese were
24 around.
24. Yeah. 24 of these individuals were not obese, walking, talking like most of us, and they had high fat in their liver. So we are sitting on a ticking time bomb. Important thing is to look for hyperlipidemia. Very important to look for metabolic syndrome. The reason for high diabetes in our country is essentially metabolic syndrome. The other interesting finding that we got out of this study was that ethnic groups, there seemed to be a bias in certain ethnic groups, and especially a lot of our X-ray and CT and MR technicians come from the state of Kerala. And there, what were the percentage of them?
Around 18 out of total 80. Like,
No.
positive.
How many were X-ray from the state of Kerala out of 80?
About 10.
And out of those, how many had?
8 were abnormal, 2 were normal.
2 were normal. So 80% and of non-obese people coming from the state of Kerala. We wonder whether it's the rice and coconut that we eat. They eat, sorry. And that's why we did the DTI of the coconut that day, because it had high fat content also. So that's it. I'm not going to take up time. I'm going to let the next speaker get in.